So Dr. Fauci says we need to hunker down through the fall and the winter. Do you think Americans are listening to him anymore, given how wrong he's been on everything? For example, in the beginning, he said, we have no immunity to this. No one has any immunity. But now we know there's some T-cell immunity, for example, as much as even 50% from people who've had coronavirus colds in the past. He also said this was basically 1918 over again, but it's nowhere near that. Do you think people are listening?
Well, I think here Dr. Fauci is saying that things are not going to return to normal when the winter kicks in, because right now we see, people dining outdoors and doing some things outdoors that are safer than being inside. And in the winter, when it gets colder, people are going to be inside, and he's expecting cases to go up. But what's missing here is he's not talking about what's the course of action. How can the American public plan for this in advance so that there are no lockdowns? Because if you go back to August, Fauci was saying there should be no more lockdowns. He didn't see a need for that. So is he reversing that? It sounds like he's just, adding to the anxiety of the American people. And you could say he's just adding to the fear. I think a lot of people listen to that language, hunkering down, and they're like, oh no, this is more bad news. What's the plan? What's the course of action? And what is Dr. Fauci telling the administration in terms of what the American people can do in advance to prepare for the colder weather, mixed with the threat of the flu as well?
Definitely. I think a lot of this goes back to our this thing from the experts that we're seeing. We can't really trust them. We never know who's telling the truth, who's just trying to make a name for themselves in this pandemic and kind of, get ahead, for example, or even Dr. Fauci even getting magazine covers and perhaps probably a book deal in the future, like I single-handedly saved America from this pandemic. So it's kind of hard to know which experts are actually there for your health and which are there for their own pocketbook. So with that, I saw the CDC recently, I believe it was August 28th, they tweeted out, I have it right here. They said face masks can't stop the wildfire smoke, so stay inside. But the funny thing there is we know the virus is as much as 10 times smaller than the smoke particles. So if I go outside in the California air with the wildfire smoke and my face mask can't protect me against the wildfire smoke, how's it going to protect me against the virus? And what does this say overall about the leadership we've been given?
Look, I think if you go back to March and then you look at today, what exactly has changed medically concerning COVID-19? I mean, experts know more about how the virus behaves, but we're still in the same situation because we don't have a vaccine. So until there's a vaccine and it's starting to be implemented and it's safe and effective, we have this situation to deal with, and we have to prepare for the winter months. The good news is the daily average of new cases right now nationally across the U.S. is actually declining. So I think local officials should be preparing locally. If they have a spike in cases heading into the winter months, how will they deal with it? I don't think there's a one-size-fits-all approach here, because certain areas are seeing a decline in cases. Other areas are seeing a spike. So you can't have a one-size-fits-all approach from the medical experts for every single area across the country. There are different recommendations, I think, for each area. So we're probably going to see more of that heading into the winter months.